everybody. I'm Ellie from Nourishment Redacted, and welcome to Lioness Lifestyle Live.
And I am Cristie over at Meeting Wellness, and I'm so excited, as always, to meet with you this evening.
And I'm AdrianKGledhill. If you have any questions for our amazing expert guest tonight, please put a QQQ or question in front so we can be sure to get that to them.
And if you've watched our show even one time, you probably know what that means. It means it's time for this week's Roar of the Week. It's ginormous. We have to peek over the top. We have to perch up here. But thank you, David. What is that, David? 2 in a row? I think Adrian picked this one out. But he says, congratulations on the 1-year anniversary. Thank you so much. If you haven't seen our 1-year anniversary show, check that out in the replay. It was such a fun show to watch, David. I totally agree. Thank you.
Okay, without any further ado, please welcome our amazing guest, Dr. Leslyn Keith.
Hey, everybody.
Hello.
Hi. Welcome to the show. We are so happy to have you and learn so much from you. Could you please introduce yourself, talk about your specialty, and also a little bit about your healing journey too. We'd love to get to know.
Yeah. Well, I'm Leslyn Keith. I have a doctorate in occupational therapy, which incidentally, I pursued that doctorate just so I can study diet and lymphatic disorders. But I'll get to that in a second. I originally, in my training, I specialized in working with lymphatic disorders. So as an occupational therapist, I got training to become a certified lymphedema therapist, which means that I would work with lymphedema and lipedema mostly, but there are other swelling conditions that I would treat. And so I did this back in the 2000, and I opened up my own clinic, and that's all I was seeing was just people who had some kind of swelling disorder, mostly lymphedema and maybe about a quarter lipedema, and then other conditions. And while I was doing that, 2 seemingly separate things happened, but they ended up being part of all the same thing. One is that my life partner, he developed an issue where he would bottom out about 3 hours after eating his very high carbohydrate breakfast. And we didn't know anything what was going on. And we finally figured out, he was, having a hypoglycemic event. He was just bottoming out. His blood sugars were not staying stable. They had a whole family of people with type 2 diabetes. And so we started looking, what's the best way for him to eat? And so we started looking at low glycemic diets and eventually came to low carb and keto. At the same time, I had patients, probably about 75% of my patients were coming to me who they were obese. They had a swelling disorder happening and they were also obese. And I was looking to my professional organizations, and they had nothing. They could give me nothing to help these patients. So I would work on them. I would do their standard treatments that we would do for someone who has swelling. And then 6 months later, they would come back and they'd be worse and maybe even gain some more weight. And so I'm thinking that there has to be something out there to help these people, because I had nothing. I mean, all except, eat less, move more, which we know how well that works. So one of my patients, she gave me a book, and she just kind of left it for me. Read this if you want. It's a really good book. And it was Gary Taub's Why We Get Fat. And I'm thinking, well, I'm not overweight myself. I didn't even think about my patients. I don't need to read that. There's probably nothing new in it. And so it sat for 6 months. Well, my boyfriend read it and he goes, this is amazing. It actually is going to help me, with, eating a certain way and regulating my blood sugar, and I'll never become overweight. But then I also started thinking, wow, okay, when I read it myself, finally, this could help my patients, because what they were starting to say in the lymphology world is that the majority of people, they were getting lymphedema, especially not because of cancer treatment where they removed lymph nodes and they radiated an area and then they got swelling after that. That wasn't the major reason they were getting it. In the US, the major reason is because of their weight, is because of obesity. So I thought, okay, great. Well, this way of eating, studies show this is the most successful way to lose weight. I'll have them use this to lose weight, and then their lymphedema will be much better. And that was absolutely true. But then my patients who didn't even need to lose weight said, well, I want to eat that way. Okay, so let's see what happens to you. And so without any weight loss, because they didn't need to lose weight, their lymphedema got better. And so I started thinking, originally, it was just the whole, weight lymphedema equation, that it was too much pressure on the lymphatic system. You lose the weight, lymphedema gets better. But I didn't think that it was just, wow, this is healthy for the lymphatic system by itself. And so I wanted to get my doctorate so I could do a study, because this had not been looked at all for related to lymphedema. And so I did a small pilot study with a group of my patients, use this way of eating, and saw what happened to the lymphatic system. It was pretty amazing. And I just have grown from there and done more research from there. But it is truly amazing that this way of eating, cutting your carbs, adding fat, that's what the lymphatic system responds to. And your lymphatic system, it's involved in every organ in your body. It's an amazing thing it has to do with your immune system. It has to do with, that's how you transport your fat, your dietary fat. It's how you keep the fluid balance in your body. It's really integral to your health in just about every way. And so even for someone who doesn't have a lymphatic disorder, this is the healthier way to eat for the majority of people. So I was pretty excited about it. And then, so this worked good for lymphedema. And so then I met Catherine Seo, who was part of the Lipedema Simplified and Lipedema Project. And she said, well, this works so well for lymphedema. What do you think about lipedema? Because traditionally lipedema is a condition where it is totally non-responsive to mainstream dieting and weight loss approaches. Doesn't respond to bariatric surgery, doesn't respond to low fat, low calorie. It doesn't, or intensive exercise, it doesn't respond. And so we thought, let's see what happens. And all I had at that point was the protocol to be used for someone who has epilepsy. And we know that the traditional ketogenic diet they use for epilepsy wasn't that great. I mean, it was really high in seed oils and stuff like that. They were trying to really get the fat up so to keep them from having seizures. And so at that point, I was using that protocol, so I didn't know anything else. And we were talking to a bunch of women with lipedema online and said, I don't know, try this out. And so people they were absolutely said, well, what the heck? I've tried everything else. Let's try this. And they were doing it. And they were emailing us back and said, what do I do now? I've lost 50 pounds. I've never lost that much weight in my life. And I'm losing it on the areas where I have lipedema, which is traditionally on the lower body. And so we started thinking, wow, this is amazing. And this was way back in, I would say, Catherine and I started doing this at about 2017 or so, like that. And so over the next several years, we started refining what is going to be best for someone with lipedema. And we've kind of made it, different from that traditional way of eating that was so successful for managing seizures. For lipedema is going to be a little bit different. And then along came Carnivore. Oh boy. And several of people in our community started saying, well, maybe this would be even better to be zero carb, and maybe I need to be high protein, maybe I need to be high fat. I don't know, but let me give it a try. And, people who had been losing weight and even on the lipedema areas of their body, getting smaller and doing really well, they were at a stall. And so they went to Carnivore, started losing that body fat again. And so this is now, something that's very exciting in the lipedema community. And happily, clinicians and researchers have taken note. And now there's about almost a dozen case study reports, clinical trials, a randomized control trial, all with lipedema, using a low carb or a ketogenic diet. So far, they haven't used carnivore, but using those ways of easing, sometimes comparing two diets to each other. And it's now starting to become more well accepted that this is, for lipedema, this is probably the better way, the better intervention to do with diet. For lymphedema, we're a little bit slower. Mine is one of the only studies that's out there. There's 3 others with lymphedema. And I think the problem is that there is an animal model of lymphedema. So researchers love to do stuff on mice. You can control them a lot more, especially when it comes to diet. It's so hard to do a diet study. And so they would much prefer to do a diet study with mice. But lipedema, there is no animal model of lipedema. So they went straight to people. And so for that reason, we have much more information on lymphedema than we do, lipedema than we do on lymphedema. And we have a lot of animal studies on lymphedema, because they've done just, what happens to the lymphatics, when we give them these mice a high fructose diet, what happens to the lymphatics? And so they're euthanizing the animals and actually looking what happens to the organs of the lymphatics. And so that we've learned a lot about that. Now we need to get it more into the human realm.
Wow, that's an amazing, just encapsulated that so well in such a little short time, but it brought up a million questions. It's hard for me to pick which one should come out of my mouth first. It really seems like, as you sort of learned about this, it was almost a partnership, the way you were talking about it, between you having an idea and then throwing it out there, and then your patients yeah, we're going to try this and this works, but then how about this? Almost like a partnership back and forth.
Yes, we need that in healthcare so much. At Lipedema Simplified, we work with Dr. Matthew Carmody, who his favorite saying is, the wisdom is in the patient. That is the person who is the expert on their body. And when your patient tells you, that doesn't work for me, this hurts, when I do this, this is really good, you have to believe them, because they are the expert. And so he has really been strongly advocating for having that kind of partnership you're talking about.
Yeah, that's fantastic. I was wondering if, based on that, if you've narrowed down the protocol at all for the different fats to proteins and how much fat there should be, how much protein there should be, or is that, have you found that to be super individualized? I feel like it's super individualized with all of us carnivores, everyone that I know. It's I need more protein, I need more fat. Is that true of people with these conditions as well? Or is there
we've been able to, as the low carb ketogenic carnivore community has done more research and done more collaboration and learning, so have we been able to refine, and probably in very similar ways, in the lipedema community and the lymphedema community. And so, yes, but there still is a lot of individuality, because what we're finding out is that lipedema is just not one set of, everybody with lipedema presents like this. There is a huge variety, and we're thinking it might even be several different phenotypes of lipedema. So you can't say that every person with lipedema they can follow this prescribed diet and it's going to work perfectly for them. And what the newest thing that we are talking about now is that there's a certain subset that is having dysfunction in the central lymphatics of the trunk, which one of the huge things that you do in the lymphatics of the trunk is you transport dietary fat from the intestines up through the center of the trunk and deposit it into the venous circulatory system. And if there's something wrong with that, you can imagine that you're going to have difficulty getting enough fat. But also, if you overwhelm that system with too much, like if you did a high fat carnivore instead of a high protein, you may not do so well. And so, and these people who have the central lymphatic dysfunction are a little bit hidden right now. The medical community is not so sure how to diagnose it, how to detect it, especially when it's a milder form of dysfunction. I mean, if there was hugely something wrong, they were born with a malformed thoracic duct or something like that, at birth, you're going to know, oh, this is, something with the central lymphatics. But a lot of people will have much more mild symptoms that present as gastrointestinal upset, difficulty breathing, getting bloating in the belly, especially after a high fat meal. I mean, and it can fluctuate in intensity. And so it's harder to diagnose and then to say, okay, maybe we need to do this. And so that's the latest thing that we're working on, is that little subset of people with lymphatic disorders, and possibly a lot of our people with lipedema are having those issues on some degree. And so we really have to tailor the diet specifically to that, what's happening in the individual person. But in general, a lot of our patients with lipedema do not need a high fat diet. Moderate fat is probably going to be good, but because they have an excessive amount of adipose tissue, if they're able to access that by having their carbs lower, that can be the high fat part of their diet. And especially if they might have something going on with central lymphatics, we don't want to immediately transition them to eating super high fat. And there's a lot of psychology in it as well, that the vast majority of patients with lipedema are female, and females are much more apt to be the vegans and vegetarians. And if you say, the best way for you to eat for this condition is going to be start to have a lot of animal source foods. I mean, a lot of them tell me that they look at their plate and they become nauseous just looking at that food that they have been told is bad for them for, 5 decades. So there's that psychology to work through too. And so I think a lot of them have to have a slower transition to this way of eating.
We did have, just on the same exact topic, our friend Linda, the carnitarian. She's actually a longer term carnivore. So she's really had time to play around with different fats. Yes. And she said high fat made her swell. Mm-hmm. And so she feels so much better on lower fat or moderate fat. Mm-hmm. And she said, I'd like to better understand how high fat meals overwhelm the lymphatic system.
Yes. Yeah. So medium chain and short chain fatty acids go straight from your intestines through the portal vein to the liver. Okay, so they bypass the lymphatics. But long chain fatty acids, which is probably most of the fats that we eat, are long chain. The only way they get out of your intestines and to the bloodstream is through the lymphatic system. So you have these specialized lymphatics called lacteals that absorb the long chain fatty acids from the intestines, take it to the thoracic duct, and then it's going to travel up the thoracic duct, which lies right next to your spine. And eventually on the left side, right below your collarbone, it's going to connect with a vein. Now, it may be that all of that is working perfectly, but also feeding into the thoracic duct, 40% of the fluid in the thoracic duct comes from your liver. It produces a huge amount of fluid. Your lungs are also dumping into the thoracic duct. And so if there's an issue happening with that, with your kidneys, I mean, all of your organs are all dumping into they're being drained with their specialized lymphatics, and it's all draining to the thoracic duct. If any of those are having an issue where there's a plug anywhere, then stuff start moving backwards. It starts refluxing. And so what can happen is say you've got a problem with the drainage from your liver. And so now you've got too much into your thoracic duct. It's not facilitating correctly. And so it is going to back up maybe into your intestines and give you nausea and GI upset. But also, since that stuff's not moving out of your intestines, you get this bloating after the meal. So it may not be a problem with your intestinal lymphatics, but some other thing in the trunk that's then causing a backup into your intestines. You could get a backup into your lungs because of having too much of a load in your thoracic duct. Now you get difficulty breathing. But also, the lymphatics are meant to flow towards and drain away from the organs. And you have stuff going the wrong way, especially when you have fat that's being transported and then going the wrong way into an organ. Now you've got fat going into the lungs, for instance, and this that fatty lymph is called chyle. And so that person that it goes into their lungs, they're coughing up this bright white sputum. It's not like your typical yellow phlegm. It's bright white. And so that's one big sign that that's happening. There's also a test. You can do a simple urine test for chyluria. So chyle in your urine. Stuff should not be going backwards into your kidneys and getting chyle in your kidneys that you then, do on a urinalysis. There should be zero chyle in there. So Dr. Max Itkin, who's at the University of Pennsylvania, specializes in dealing with these disorders. And he said, that's diagnostic. If you have chyle in your urine, you have a central lymphatic disorder. But now, how do you get your doctor to do that test? It's just a urine test, but the doctors they said, I don't understand it. I don't know what this is. And so a lot of them won't even order the test. If you think you've got something like this happening, what I'm describing, you convince your doctor to do that test and say, I will take the information to someone who knows how to read the results. If they would just order it, then that may help. But again, this is such an elusive condition that just because your chyluria test is negative does not mean you don't have a central lymphatic disorder, because it's just not backing up into your kidneys. It could be backing up somewhere else. So, and I know we got a little bit off topic here, but when we're thinking about, how our eating can help particular conditions. This is my newest thing that I'm really excited about, is trying to help people identify a central lymphatic disorder. And now we're kind of in new territory. How do we eat when you have that situation? We're still trying to figure that out. There's a group of us of patients who have been identified, and clinicians that were kind of in a think tank together, and they're willing to do citizen science and experiment. Well, let's see if this works. And we're trying out various things. Vibration, holding a vibration ball against your belly or up, with the connection with your lymphatics to your venous system, seeing if that helps. Some people say yes. So we're really playing around with that.
Wow, this is just like blowing my mind. I've just learned like 1%, not even, let's say like 0.1% of these subjects. But you did say backstage that you would help self-diagnose, what to look for, what to feel for. That sounds like fun. Will you share with us how to do that?
You bet. And we at the Lipedema Simplified, we have developed it's a 2-page front and back handout that you can print out to take to your physician, but you can also use it on yourself to help you figure it out. And so what we're looking for, the symptoms of lipedema, number one, it's excessive fat deposits, almost in a disproportionate kind of a look, where especially to the lower body, and it can happen anywhere from the waist to the ankles. Usually the feet are not affected. So, but it might just be the hips and the buttocks and not in the legs at all. It could go all the way down to the knees. It could go all the way down to the ankles. But looking at that lower body and seeing if does it feel disproportionate to your trunk. Now, if you also have obesity on top of lipedema, it can make it harder to discern, do I have this asymmetry? So we're going to do some other tests to see is that fat in your lower body and sometimes in your arms. Okay. And it can go from, shoulder all the way to the wrist or just the upper arms. So is that obesity fat or is that lipedema fat? And so some things you can do. One is you can look for a grainy feel. So if you were to, for instance, to take especially this area on the back of your upper arm, and you're going to sandwich it between your fingers and your thumb and kind of roll in there deeply. And I'm sorry that a lot of people, this can be painful, especially with lipedema. This could be painful, but you want to go deeply in there. Do you feel like little rice, little grains in there, or even larger nodules in there? Okay. So it usually will appear in this back area here. It will appear on your inner thighs. Okay. And so you're going to do the same thing. You're going to roll that tissue on your inner thighs and work it all the way to your knees and see if you feel that grainy appearance. That can be a sign. The other is that pain. There's a hypersensitivity and a pain response that other people don't seem to have. For instance, getting your blood pressure done. Okay. And yeah, it is a squeeze, but for someone with lipedema, this is like your blood pressure goes up before you go to the doctor because you're just thinking they're going to put that cuff on you and it hurts so dang bad. So it's a quite a pain response. Just having your pet jump on your lap, ow, it's very painful and hypersensitive where it wouldn't hurt someone else. So think about those areas of the body where you think you have this odd expansion of fat that doesn't seem responsive at all to exercise, to using a low calorie, low fat way of eating. You'll lose weight everywhere else, but not there. Then we're looking for those signs in there. The people that have it in their calves can get something called an ankle cuff, where the tissue in the calves will go down and then it will come in and make a little shelf. And then you might have like a pretty normal ankle and foot, but it's that abrupt ending to the fat that makes it look like a cuff. And that can happen also with your wrist if you have lipedema fat going all the way to your wrist. If you just have it in your upper arm, you might have an overhang at your elbow, but you won't have a wrist cuff. So you can see how a lot of these things can sometimes be difficult to identify because just about everybody has lipedema. You can get them all in a room together and they're all going to look slightly different. We'll identify some common features, but each person will present them a little bit differently. But you're looking for that pain, hypersensitivity, tenderness, more fat on the lower body than in the trunk typically. Oh, well, here's a big one. Having bariatric surgery because you feel like your doctors told you you're obese. So you have bariatric surgery. And after the bariatric surgery, you become emaciated in your face and your trunk. And your arms and legs, especially your legs, don't change at all. So sometimes that's when it's identified is after the bariatric surgery and oops, sorry, you have lipedema. This doesn't work for lipedema, which is quite devastating, especially if you've had a procedure where they've taken out body parts and, thrust them aside. So you can't get those back. So that can be very devastating way to find out that you probably have lipedema.
So I just wanted to bring up this point of clarification because Nia and my brains were in sync. Nia says, well, I've always been a pear. Does that count? I've always considered myself pear-shaped, but now that I'm hearing more, not just today, but in recent months, it kind of makes me wonder, like when you say disproportionate.
Yes.
How disproportionate are we talking? Because I could say my upper body can be like a extra small or small, and then my lower body can be like a medium or large. Is that enough disproportionate to?
There is a pear-shaped obesity that is that fat does not appear under a tissue sample under a microscope. It is not the same as lipedema fat. And so you really need to look for, do you feel that graininess in the fat? Is there nodules in the fat? Is there that pain and hypersensitivity? And if there is not, it may, in fact, be simple obesity and not lipedema. But there are also a lot of, when we question people who have lipedema, we always are careful to say, do you have pain or do you have a history of pain? And two things can come out in that questioning. One is, well, they're using carnivore or ketogenic eating and it fixed their pain. Okay, so now they no longer have pain. And the other one is, if you've had your pain for your whole life, you can really put it into your subconscious. So you're saying, no, I don't have pain. I mean, I had a friend of mine with lipedema and I said, have you lost any mobility because of your lipedema, because your legs are so large? No, not really. I live in a 2-story house and I get up the stairs fine. Oh, how do you go up the stairs? Well, I crawl up them. And so in her mind, the mobility problem wasn't there. She found a way to get up those stairs, but it had really affected her mobility. And I think it's the same thing with pain, is that either they think, well, everybody really has painful blood pressure tests, or no, I'm fine. I can ignore this pain and power through it. And so it really, when you're thinking about pain associated with lipedema, it really takes a lot of digging sometimes to really come back to what's happening now, what was happening before you changed your diet, and how do you respond when you go to get a blood pressure, just thinking about getting a blood pressure test, things like that. It can be, it takes a lot of searching to try to really distinguish this. And now you see why an inexperienced clinician has a difficulty in diagnosing this. We do have that one-page handout, which I will give you guys, that you can go through yourself and give to your physician, and then help your physician to be able to recognize it in you if that's what's going on, but also all their other patients, because we're thinking about 11% of women worldwide have this condition. So I guarantee you, every primary care physician out there has patients with lipedema. They just don't know it.
I find it just as devastating. It seems that this is happening in some kids. And instead of it being recognized, they're being told to go on a diet. Yeah.
So it is the most common period of onset is at puberty. And so, and it seems, and this is just anecdotal, but it seems like a lot of people with lipedema seem to go through puberty early. And so we could be looking at, 10 and 11-year-olds that are showing this pear shape. And they're just put on, a low calorie, plant-based, low fat diet, and it's making it worse. It's making it it's increasing the inflammation so that they have more pain. And this is being done to very young people. We are, children, prepubescent children really haven't been studied. There's a couple of case studies out there. And then the same thing with males. There's been case studies. So mostly we're looking at puberty on that we're seeing that being triggered. Puberty is the most often, but then pregnancy is the next most often. I've heard a lot of reports from Europe that they're talking about with using chemical birth control methods triggering lipedema symptoms, and then perimenopause. So it seems to be around those times of hormonal change, but incidentally also at those same time periods can be a natural insulin resistance. So we need to look at other hormones as well. And it might be a type of thing that's a perfect storm. We have all these things happening at the same time in people with a certain genetic profile, that when they're exposed to that certain environment, then they're presenting with lipedema, whereas maybe they wouldn't have presented if they weren't exposed to that. So what I would like to say to women who believe that they have lipedema or been diagnosed with it and they want to have children, or they do have young children, it doesn't mean that your children have to get it. What you guys are doing here in this community and encouraging that Lioness Lifestyle, is we're seeing that really has a huge promise for the lipedema population. And so if we can raise our children eating that way, they may have the gene for lipedema, but they may never present with it because they've been in this better environment.
That's so great. Just speaking from personal experience, so I've always grown up with like random bruises being on my legs.
Yes,
and
that was another one. Sorry, I forgot that symptom.
No,
Yes.
you're doing fantastic. Seriously, I'm like learning so much. My brain's like, okay. So I've always grown up with like tons of bruises on my legs, and people would just be like, "Do walls jump out at you? Like, what's going on?" I'm like, I don't know how that bruise got there. Like, I really, really didn't. And I noticed that, like, because I have toddlers, I have a 4-year-old and a 2-year-old, if I could lift my fingers. And whenever they're like, they just want to climb on me, and their little hands and their little elbows, it just makes me want to
Yes.
throw them across the room, right?
Yeah. And so and this is even with you eating in a way that's reducing your inflammation, you still have that response. So it tells me that, the nutrition is a huge part of it, but it doesn't fix everything that's going on with lipedema.
Yes, I noticed that I'm bruising less. Like, I used to just get like giant bruises, like especially around my calves and around the calf area specifically. And I noticed that, there is some tenderness. Like when I get the blood pressure, it's just like, oh, like breathing. But like I said, I don't really know. It's like a toss up. I could have just been really obese because I don't necessarily feel the whole, like, I don't think I feel like rice or, or like Linda was saying, peas and carrots necessarily, but maybe I'm just so used to the lymph nodes. I don't know. But I just, we did have, let me ask from someone who actually does have it, she was wondering about vibration plates.
Oh, yeah.
Like, what is the best way to use that for lipedema?
Yeah. So it all depends on you and all the other things that you might have going on, because there are some contraindications to vibration plates. For instance, if you have a metal plate, you had a joint replacement and it's held together with metal plate, you don't want to shake that loose. So being conscious of just the general contraindications, but also dealing with your own stability and your own balance and your own tolerance. So some people are starting with, they're sitting in a chair and they're putting their feet on the vibration plate. They're sitting on the vibration plate. So if you're able to stand on the vibration plate and do it that way, you start out at, at the lower amplitudes and maybe only about 5 minutes. But it has been shown to very much help with lipedema. This is a very popular intervention. There's been a couple of clinical trials using testing vibration plates and lipedema. So we're starting to get some more evidence that this is beneficial. There's a lot of fibrosis or scar tissue that develops in the fat of lipedema. And I think that's one reason why it's resistant to typical weight loss methods. It's almost like the scar tissue is holding it there and won't let go of that fat. And the vibration might actually be helping to reduce and dissolve that fibrosis and scar tissue. And so it's letting you, if you're now eating in a good way, you can release that fat. So, and it's also very good for increasing bone density. And if because of your lipedema, because of the pain or the size of your legs, you're not able to exercise a lot, especially impact exercises that are going to improve your bone density, you could probably get it, help with just with the vibration plate. So yes, I encourage, as long as you don't have contraindications, to try that intervention.
Thank you for that. We had another question here from Susie wanting to know, is the lipedema fat accessible if a person fasts, exercises, etc.?
So we do have a lot of people in our group that are using a carbohydrate restriction in conjunction with fasting and with exercise. I do think that particularly with resistive exercise, probably going to be one of the best, that I would start with the diet, because if you're hurting, it's really hard to exercise. So start with dieting and maybe fasting. And I would start with just intermittent fasting and just like that longer overnight fast and something like that. Nothing more than 24 hours when you're first starting out. Start with that, get the pain taken care of, and then you can start adding exercises. But yes, when we're looking at more of a holistic approach, I will have to say, I mean, I was so interested in the diet that's all we talked about with lipedema was keto for about 2 or 3 years. And people were saying, but there should be other things that we should work on too. So yes, I mean, this person who suggested this, then yes, I would suggest when you are feeling well enough, you add the exercise.
Okay. And just as a quick follow-up, Nia says or rebounding with the little mini trampoline. I hear that's great for so many things. I've heard so much good stuff about rebounding. Can you comment on that as well?
And even just I like the type of rebounding where you never actually leave the rebound. You just kind of go onto your toes and you're kind of still staying contact with the rebounder with your toes. And it is such a huge such a huge impact on the lymphatics in your calves, because you think about the drainage that's happening in your legs, in particular lower legs, that has to fight against gravity. And when you're activating those muscles, you're helping those lymphatics to get that fluid out of there. Interestingly, as in the early stages of lipedema, the lymphatics seem to actually be working perfectly fine in the early stages. But as the condition progresses, and it doesn't have to, but if it does progress, the lymphatics become impaired and they start leaving fluid behind. And whereas your foot looked completely normal, now you kind of have swelling in your foot at the end of the day. And so if you can facilitate that drainage by activating your calf muscle, then rebounding is a fabulous way to do that. Yes.
This kind of goes along with, is compression helpful? And we also have a question about fascia blasting.
Mm-hmm. Okay. So with compression, compression is typically we use that to reduce the swelling or maintain a reduction in swelling. There's not, at least in the early stages of lipedema, there's not a whole lot of swelling. So we use it mostly for pain management. It does, how when you injure something and your initial reaction is just to kind of grab it and squeeze, that compression really feels good. But you need to go to an experienced fitter and make sure you're getting the right product for you that is the right fit, because a bad fitting compression hose are really going to be painful. It's not going to help. It's going to make it worse. But going to someone who is going to do it and say, how do you feel about full leg compression for lipedema? I find it makes my belly swell. Yeah. And so particularly if you're someone who might have slow drainage through the trunk, if you just put compression on your legs, maybe to a thigh-high compression garment, your belly is going to get bigger. And so for that person, I would recommend either a lower level of compression, that just more like tights or something, not medical grade, or having, including the trunk. And they do make compression garments that are really to the lipedema shape, and they're high waisted. They go practically up to your bra strap. And so they're not going to cut your belly right in half or something. They're going to be comfortable over your belly. But there are people that, for just the reason that listener is talking about, is that they can't wear compression because it just seems to blow up their belly. So try lower level of compression. And if that doesn't work, can you cover the whole belly? If that doesn't work, you are someone who can't wear compression. And I would say for you, get in the pool as much as you can, because the pool provides that graded compression. Just when you're standing in water that's chest high, you have more pressure from the water at your feet and less pressure as you get up to the surface of the pool, which is moving the fluid in the right direction, right? So you can use compression through being in the pool instead, spend a couple hours and they're just walking in the water. It can be really wonderful, especially if you're having hot weather like we are now. I don't know where you guys are, but I'm in Southern California and it's pretty warm.
And I thumbs up because I'm in Southern California. We'll have to meet up, Leslyn Keith. Yes, that's amazing. Are you enjoying our lovely smoky air?
Yeah, and I'm a little bit further north, so I'm not getting that smoky air. But you might be getting. I mean, that's not good for your lungs. Be careful.
Not at all. Sorry, you said Southern California, and there's so few of us carnivore types here. I'm like, oh.
And so I'm getting more up towards Santa Barbara, so I have pretty clear air up here. But I will tell you that people in San Francisco, anything below San Francisco, they feel like that's Southern California. So
that's true. Okay, sorry. Back to the topic at hand. Sorry, yes. Adrian, you're up.
Sorry, it's Ellie, but I just wanted to ask this: how do you feel about the fascia blasting?
Oh, yes, the fascia blaster. Yes, it's very aggressive. And so someone who has very low pain tolerance have a hypersensitivity, that is not going to be good. But there is a place for it for the person that it does not cause them pain, because it is going to help break down those fibers, that fibrosis, that scar tissue that's kind of holding your fat captive. And so, just exercise caution with using it, because it can be very aggressive. If it causes pain, you have to stop. If it gives you bruises, you have to stop. There's gentler products out there that you can get a little bit of that mechanical type of massage without causing tissue damage.
So we did have a question from Nia. This was sent earlier, but I definitely did not want to skip it. I may be totally off here, but is it a possibility that if I eat very high fat, that could be contributing to my skin condition symptoms via the pathways you just described, backed up elimination?
So I just want to get clarification here. Is it possible that if I eat very high fat, that can be contributing to my skin symptoms? So this person is eating something that is making the skin symptoms worse. Typically that's not going to happen with high fat. The research that I've seen, at least in animals, is that the carbohydrates and the high fructose is inflammatory, because we have quite a system of lymphatics right underneath our skin. And what we're finding in research is that that high fructose and carbs is very inflammatory to those lymphatics, and the lymphatic endothelial cells, those cells that form the vessel walls, if they're exposed to sugar or glucose and ketones, they're going after the ketones. They prefer ketones. And so if you're looking for a way to reduce your skin symptoms, if that's what's going on, then the exposure to ketones, and there's even a question of, should we do exogenous ketones? Is that going to help? Maybe I can't do a high fat diet for whatever reason. Maybe I can feed my lymphatics with using exogenous ketones. At least in animals, the exogenous ketones have been really fabulous for lymphatics. And actually, in one study that just came out a couple months ago with people who have lymphedema because of cancer treatment, they put them on a ketogenic diet, and they were using that epilepsy ketogenic diet, so very, very high fat, and they were testing for their ketones. They did lymphatic imaging before and after, so 6 months was the intervention, and they saw new vessel formation during that 6 months. And they believe it was because of exposure to the ketones, because that's what's been happening in the animal studies. So we believe that this is also happening in humans as well, that we have a reduction in the swelling because we have new vessels forming over the scar tissue from the nodes being removed or radiating and destroying tissue. And so we get new vessels forming, and we have reduction in swelling. For a lifelong chronic condition. Sorry, you got lymphedema. I saved your life because we got rid of your breast cancer, but now you're going to have this swollen arm the rest of your life. Sorry. This is huge for that person that thought that this was, okay, I'm just going to have this big arm the rest of my life. Maybe we can do something about it. Maybe we can grow those lymphatics back and reduce the swelling.
Wow, that would be fantastic. You know, there's so many conditions I feel that it's like they tell you it's just going to be chronic and progressive. Oh, wait, but not if you eat carnivore.
Yeah.
It almost sounds like you just kind of described another thing that's sort of like that. You know, you're going to be stuck with this forever now. Oh, but maybe not.
Yes.
So, and actually Nia just popped this in here too. So, wow, this is so cool. I have someone in my family that had 14 lymph nodes removed. There's hope. So absolutely. I have a question about other practitioners. Do you get any pushback from, I know you had said that there were more, like it was just you, and now there's like 12, which is awesome because 12 is better than 1 or 0. But it also, thinking about the whole of the United States, doesn't sound like that many. So do you get pushback from, I don't know, other standard practitioners?
Yeah, just last night, we have a group of lymphedema therapists in my area. And we get together, you know, once every couple months. And so I said, okay, I'm going to talk about this. I'm going to talk about nutrition for lymphatics and lymphatic disorders, and how can the clinician talk to their patients about it? How can our clinician talk to the patient about the impact of their weight on their lymphatic functioning? And there was only maybe a dozen people there. And there was just one person that she kept saying, yeah, but what about your heart? Yeah, but what are the, you know, healthy fats to eat? You know, and so I could tell where she was coming from. And this is typical of the lymphatic community that, or just our public in general, that we have been trained for the last 50 or so years that fat is going to kill you, that, you know, sugar is fine, and you got to have some starch in your meals. And so when someone comes along and says something completely obvious, opposite, it's scary, and they do push back. I had spoken about this before, that it's so wonderful going to a low carb conference, and then I talk about, you know, introduce them to the idea of lymphatic disorders and how low carb works for that. And they're so welcoming and they want to learn more, and they're so excited. And then I go to a lymphedema conference, and it's almost like, you know, a pariah there. But thankfully, now there's more clinicians out there. Of course, they've done, you know, almost a dozen research studies on it. So the word is getting out, and I'm not the only one who's talking about it. It used to be just that crazy Leslyn, you know, and now there's other people that are doing it. And so people are starting to come around that, okay, this could be an option. This, you know, my feeling is just like diabetes, this should be the first line of defense. You know, the first thing we should do with someone who has a lymphatic disorder. But if I can just get it on the table as an option, then I feel like we really gain some ground. One of the biggest organizations in the United States for lymphedema is doing a bunch of position papers, and they will be putting out a position paper on nutrition for lymphatic disorders. And so I'm going to be participating in that. And I know it's not going to be as strongly written as I want it to be, but I do want to have the paper at least say, this is an option that patients may choose, a safe option, an effective option.
I've been down this rabbit hole recently of all of these different peptides. And I'm wondering if there is a known peptide, because some of these peptides apparently can zap zombie cells. And I've heard people refer to lipedema as zombie fat cells. Mm-hmm. Is there anything out there yet that can zap these?
So there's some work right now as far as medications go. There is a study going on right now at Stanford University where they're looking at anti-inflammatory medications. There hasn't been as far as I know, a lot of research done on other pharmaceuticals. But that is the one area they're looking at is anti-inflammatory, and I think it's called a Bilistat or something like that, and that they're testing that right now to see if people. I think there's a large population that would like to do something that's a lot easier than changing your diet, which can be very challenging. And so if they can take a pill, that would be wonderful. But I think there's also a lot of people that just wanted to throw everything but the kitchen sink at it. And so if I can do a carnivore diet and take this pill and use a vibration plate and, that they feel like they can have those better outcomes if I can just do, a complete program, a full program of lots of options. And so they are looking at medications. Yes.
Okay, so did you want to do the meaty wheel, Cristie? I think it'd be fun, even if she hasn't shared.
Okay.
What do you eat? What do you eat?
Yeah, I didn't get to ask you about what you eat. I was going to ask if you practice what you preach, and then maybe we can spin this meaty wheel.
So, and I before I ever did it with my patients, my partner and I did keto and resolved his issue. And so definitely I wanted to do this before I ever shared it with my patients. So I've been doing keto since about 2011. And then 2019, I went into carnivore because it was being talked about so much in the lipedema community. I thought, well, I guess I should see what this is all about. And, your first thought was, well, then I won't be able to have blueberries anymore. And, and so, it's just like our patients do when, they're having to give up bread and stuff. So I was actually thinking about, my favorite plants or whatever. But you know what? It is, don't miss it at all. And now if I actually, have go and give me that blueberry. Oh God, that is so tart. How could I have ever eaten that before? I think I stick with meat. Meat is good.
Yeah, I'm with you on that. Okay, well, I am going to present to everyone our meaty wheel. All right, here it is. We're going to go ahead and see what kind of a question we can spin for you. All right, we hunted down a meaty question for you, and here it is. How do you handle meal planning and preparation on a carnivore diet, and do you find it challenging or time-consuming?
Wow, it is so much faster. I don't think it's challenging or time-consuming at all. What are we going to have tonight? Steak? Okay. We like using the sous vide. And so we put that on, for a couple hours before we leave the house, come back later, it's done. And we have an AutoWild grill that gets up to 1500 degrees. And so we're just searing it. And so that's, takes 10 minutes to sear both sides. And then we're ready to eat. As a side dish, sometimes I make some shrimp cooked in butter with some bacon, and dinner is done. We did get a Ninja Creamy. I don't know if I'm allowed to say products, but we did get that. And then we make our own homemade ice cream, which we do with a dozen eggs and a pint and a half of heavy whipping cream and a little bit of vanilla. We do not need any sweetener at all because to me, cream tastes sweet. And so we just, that freezes for about 7 hours, and then we whip it up in the Ninja Creamy, and we have the most delicious vanilla ice cream every once in a while. So that's about all I eat. Throw in some eggs, and that's about it.
She's a lioness. Wow. I don't know that. I love it.
Now, tell me on a lion diet, is there tea and coffee?
Not for me. I eat a varied carnivore diet. The lioness is the symbol, is a spiritual animal for us.
I still include coffee personally, but Adrian, how about you?
I currently have coffee. Yes.
Mm-hmm.
Don't be mad, Dr. Lisa. Don't be mad, Maria Emmerich.
Yeah, and I think there's a lot of views on that. I have gone through times where my favorite thing is tea, and of course I prefer the caffeinated teas. I don't really like the herbal teas. So time of experimenting with and without the tea. The latest thing was that Ben Bickman talked about the tannins in tea might interfere with calcium absorption and could be a problem for osteoporosis. So, I think it's worth experimenting and seeing how you do. I mean, I do feel like the caffeine is definitely addictive, and the days that I don't have it, gosh, I wish I could have a cup of tea. I think it gives me more empathy for my patients because they're going through similar experiences with whatever type of food. So.
Did we want to show Leslyn's website, or where can people find you?
So yes, you can find me at my website, leslynkeith.com. And I would also really love to tell people about that at Lipedema Simplified, we're having a virtual conference event coming up September 27, 28, and 29. It's a Friday, Saturday, and Sunday. And we're going to be talking about the holistic approach to managing lipedema. This is for clinicians, for patients, for caregivers to come to this event. So it's going to be talking about, yes, what to eat, but it's also talking about, so there's our website. And I think if you click on lipedema events, and it should have our heart to heart is coming up, right? Maybe that's it. We will see. Yes.
Hey there.
And that is it right there. So your roadmap to living well.
And try and get a
okay, you got the audio going
for
on.
lipedema. Have you gone and felt unheard?
There we are. So check that out, and I'll give you the link that you can put that with the show notes to. We are having early bird special. It's only 147 for the 3 days, but closer to the event, the price is going to go up. So if you think you might have lipedema, be there, join us for this event.
Wow, this is such an important topic because people just don't know. And I feel like so many people are being misdiagnosed, underdiagnosed, and they just have no idea. So thank you so much for talking to us about this today. We kind of warned you that we roar at the end. So you can join in or not, but I'm going to count us down, and then we're going to have everybody in the chat. If you want to put your roar in there, please feel free. All right, ready? 3, 2, 1. Roar!
Yeah, she gave us a thumbs up. She approves this message of roaring. I love it.
Thank you, guys. It was wonderful being here with you. It was great to meet you all.
Oh, it was wonderful to meet you. And yeah, I've watched a lot of your stuff on YouTube that you've done with other people. So to have you sitting here next to me, virtually next to me, is a little bit surreal and super cool. So yes, thank you for agreeing to meet with us this evening. We absolutely enjoyed it. And thanks to everyone who tuned in. We hope to see you back here 1 week from now, and we will have another amazing and awesome guest for you. Good night, everybody.
Bye, everybody.